We truly believe it's the right thing to do. So for our patients, we want to ensure that they get the care that they need in the place that's the most appropriate at the time when they truly need it. So I actually heard a really interesting story lately that I think can really outline why we are focusing on this. This did not happen at our hospital, but there was a patient who came into a hospital because they had anemia. So anemia is when someone doesn't have enough of the healthy red blood cells in their system. And the acute care hospital that this patient went to, they treated the anemia, got them ready to go back home, and they were about to send the patient home when someone asked, why did they have anemia in the first place? And when they looked into it, they discovered this gentleman had bed bugs in his home, and they were literally eating him. And they said, we cannot have this patient go back home because they'll just come back into the hospital. And the team really worked with the family to clear the house, get it all ready for the patient to go back. And that is truly what we want to do. We want to look at our patients holistically so that we can keep them healthy and safe in their own homes for as long as possible. Because nobody really wants to be in the hospital, let's face it. It's a difficult place to be. You're exposed to possible infections. You can be deconditioned. We want you to be in the right place so that you can get the right care for you. And most of the time that is helping people leave our organization so they can be healthy and safe in their own homes. Our new strategic plan is really going to help us focus on the patient journey. So instead of doing 1,000 things to try to help our patients, we'll really be focused on their journey of care so that we can all be singing from the same songbook, including our patients as part of the team, so that we can all be working together to help them have the very best journey, the very best transition home, or maybe a transition to another place that'll be more supportive and conducive to our patients' needs. We still need to focus on what we've been focusing on in the past. I think we just need to focus on it in a new way. So for example, we've really been caring for patients who have mental health challenges, our Indigenous patients, our seniors, and we want to continue to do that, but in a deeper way that is much more focused on their journey and making sure they get the right care at the right time. Our staff are key to caring for our patients. So if we don't care for our staff, they won't be able to provide the care that our patients really deserve and need. So we want our staff to be more involved than ever before in our strategic plan. And we really see this as an opportunity to engage the people who do the work in planning for the patients that they care for every day and really enabling their journey. Well, it's time to wrap up our strategic plan 2020, so that is coming to an end, and that means we need to have a new plan to help us all focus on what is best for our patients. So the time to sunset the last plan has come, and it's time to start planning for what's next to enhance our patients' journey. Well, this plan is really going to give us an opportunity to do more for our patients in a more collaborative way. So we can only control what's in our four walls, or at least that's what we sometimes believe. But we see a huge opportunity to partner and collaborate with all of our partners to ensure that our patients can stay healthy and safe at home for as long as possible. So we need to do a better job of partnering with community agencies, for example, who can support our patients after they leave our four walls, or maybe even prevent them from having to come to our organization in the first place. It is incredibly important so that we all know what we're doing for our patients. I don't know if you remember the story of John F. Kennedy when he was president. He said his big goal was to put a man on the moon and return him safely to Earth by the end of the decade. So really what that did, it helped the whole nation focus on what was important. It got everyone inspired to achieve that goal, and everybody knew what they were doing and why they were doing it. So there's the stories of JFK going to NASA and asking the housekeeper, what do you do here at NASA? And the housekeeper said, I'm here to put a man on the moon. So we want to have that same big promise that we can communicate so that all of our staff know what we're doing and why we're doing it, and they can really be part of making it happen.